Hi, my name is Lindsay. I'm one of the nurses at the McMinn Clinic, and today I'm going to show you how to give an IM or intramuscular injection. So we have our supplies here. You will have two different types of needles. There is an injection needle, and then there is a drawing needle. The drawing needle, you'll just notice visually that it's thicker, and it's one that you probably wouldn't want to inject in yourself. The lower the number, the bigger the needle is in diameter. So we use that bigger needle, that lower number, for drawing up the shot. So in this case, I have a 20 gauge needle for drawing up, and I have a 25 gauge for injection. I also have some alcohol prep pads, and I've got two different sizes of syringes. Depending on your dosing, you'll either receive a 1 ml syringe or a 3 ml syringe. And you'll be able to tell that based on the numbers on the side. This is your 3 ml syringe, it's a larger syringe. And then we have our 1 ml. So, what we'll do first is simply just open up your syringe. I like to open it with the actual injection end down, and where I'm going to actually use my hand, I like to have that at the top. That way I don't dirty that bottom part. So go ahead and pull that out, and we'll use that drawing needle first. And open up that end that's going to screw to your syringe, and that's exactly what it does. It just screws on. And now we'll go ahead and draw up our medication. And this is, for example, it's a single dose vial, but many of you will receive a multi-dose vial. And when you do, you'll want to make sure you clean off the cap before you draw up your medication each time. So all you need to do is use your alcohol prep pad, clean off the top, uncap your needle, and it just pulls directly out. You don't have to twist, just pull. And then you will dart that needle right into that rubber stopper, and you'll flip this upside down. That way all of the liquid in the vial goes downward towards where your needle and your needle is, so you can draw it out. And you simply go ahead and pull back on the plunger of this syringe and draw in your fluid. I always try to draw in more than I need because you end up having an air bubble at the top. And that allows you just kind of push back up that air so that you get the exact amount of medication that you need. A lot of times the standard dose is either 1 ml or 0.5 depending on the medication that you're using. So today, for example, I'm drawing up 0.5 or half of a milliliter. So once you've done that, you just go ahead and remove your syringe and your needle. And we'll go ahead and recap very carefully. And what you also want to do is when you're drawing that into your needle and syringe, so as not to have any waste with the medication, you'll want to pull back on this plunger of the syringe. And that draws out any fluid or medication that's located inside of the needle in what we call the hub, which is right next to that needle point. It's in that yellow area. So then go ahead and twist this off, and we're going to swap out and use our actual injection needle. And if you'll remember, that's that 25 gauge one. So then we'll go ahead and twist this on. And since I pulled back on that plunger to make sure we didn't waste any medication, now I need to do the opposite action and push that liquid up through the hub of that needle. That way I am now ready to give my injection. All right, so now we'll talk about administration locations. Here at the McMinn Clinic, we recommend two sites. This first one is called the dorsogluteal location. And as you'll see, we have a diagram to show that to you. You'll divide each glute muscle into 4 quadrants. And this green area is where we could give the shot. It's considered the upper outer quadrant. It's important to really visually see these quadrants. We want to avoid giving it closer into the middle of the glute muscle because of the sciatic nerve innervation. We do not recommend that patients self-administer their shots in this location due to the difficulties with administering it appropriately. And for liability reasons, we would not advise that. We show this for anybody watching this video that is wanting to help their spouse or loved one administer this injection rather than that patient administering it on themselves. So that is this location. right, and this demonstrates the dorso-luteal location. And again, we want to make sure that this is ideally for someone administering the shot to the patient rather than self-administration. You'll want to make sure that the patient offsets all of their weight onto the opposite leg so that this muscle is most relaxed. You'll divide this muscle into 4 quadrants, and we're targeting the upper outer quadrant. Again, 4 quadrants targeting the upper outer quadrant. And you'll just use that 90-degree angle to dart it in after cleansing the site. What's important when you're giving this shot from week to week is that you rotate locations, meaning you'll give the shot on this side one week and you'll rotate to the opposite side the next week. Now we'll demonstrate where to give the shot in the thigh. And this is, again, the best site for self-administration. What you'll want to do is be in a seated position. That way the muscle is most relaxed. And visually, what you're looking for is to target the middle third of your thigh, and it can be the top part or the outside part. Another way you can visualize that is placing one hand at the top of your leg, up of this thigh area, up near the knee, and one hand at the bottom. And you're, again, targeting this middle third location. You will, just like before, you'll clean off that site with some alcohol, and then you'll use your 90-degree angle to dart that needle in, either on the top or the outside. And as you're giving these shots on a weekly basis, you will want to rotate sides. You can do the top, you can do the side the next time, and then you can go to the other leg and do the top and then the side. You want to continue to alternate to avoid scarring of tissue and best absorption. So now let's talk about the actual injection process. So once you've chosen your location, you'll go ahead and use an alcohol prep pad to clean the site. And we're using an orange for demonstration here. So go ahead and clean that side off. And then you're going to use a 90-degree angle to insert. And you'll just flick your wrist very lightly. The needle is sharp, it goes right in. And, all right, 1, 2, 3. And what you'll do here is you'll need to stabilize the syringe. So, because I have an orange, this is a little bit harder to demonstrate, but you'll pull back on this plunger of the needle. What we want to see is exactly what you just saw there, empty space, a bubble. If we were to see blood come back into the syringe, into the hub area, right where my thumb is pointing, that would indicate that we're in a blood vessel rather than just in the muscle. And if that happens, what you need to do is just simply pull out, change your needle, and swap it out for a new one, and choose an alternate location, and go ahead and give your injection there. Now, let me show you the full process. We will clean the site, one, two, three. Pull back, no blood, and go ahead and push in the fluid. Now you'll notice that the hub of the needle, this very end, is all the way submerged, and that is exactly what you want to do with the muscle tissue. Once you're done with the injection, pull back out, dispose of your needle, clean off any residual blood, and apply your Band-Aid.